Hi, I'm Dr. Mark Wheaton, physician and owner of Lakeside Sports and Pain Clinic. And we have offices in Excelsior, Minnesota, and right now we're in Monongah, Minnesota, where today I'm going to discuss the treatment and the diagnosis of arthritis. Arthritis is a common term, and arthritis technically means inflammation of a joint. And it can afflict most of the joints of the body and results in disability of a lot of people. In fact, it's the most common joint condition in our country today and results in many treatments, anti-inflammatory drugs, cortisone shots, and joint replacements, all of which don't necessarily solve the problem. So let's discuss how a person gets arthritis. Arthritis is generally seen as an injury process that happens slowly over time, where there's a wear and tear that goes on. Now, one might not remember an injury, but it results in a lot of damage to the articular cartilage. Okay, what I'd like you to focus on right here is the normal joint. And in the normal joint, you can see the two ends of the bone of the knee as they come together. And then the bluish area is the cartilage. The cartilage is what ends up being degraded in osteoarthritis. So as we look over here with osteoarthritis, you'll see that that blue cartilage has been worn down so that the ends of the bone now contact each other, and a person then would develop bone-on-bone arthritis and bone spurs and the like. There's often swelling that occurs around the joint and, of course, pain. So we look at the other variety of arthritis, which is rheumatoid arthritis, and in that diagram we see that there's a preservation or retention of the cartilage. It's not worn down, but yet the synovial space, which is the fluid capsule around the joint, becomes inflamed. And for that reason, it's called an autoimmune disease. There's no particular wear and tear phenomenon. It seems to be somewhat of an inherited trait, and it's unknown as to the mechanism and why that occurs in some individuals. Okay, so as we look at the hand here, now we can see a little better where the joints are damaged in rheumatoid arthritis. It's these joints, what we call the metacarpal phalangeal joints, MCPs, is where that occurs. Now, the damage to the joints in the osteoarthritis typically occurs at these knuckles there. And in fact, there might be just a little bit on this patient right there where you can see the little nodule, the very early sign of osteoarthritis. More commonly, with osteoarthritis too, you'll get damage to this joint. So there'll be a crunching when I put the joint through a range of motion. It'll feel kind of crunchy and painful, and I'll put some thumb pressure on it and it'll be painful. In her joint, it moves very smoothly and there's no problem there. And she has no complaints per se with her hands at this point. So hopefully this patient will not develop arthritis, and then we'll talk about treatment in a second for those people who do get it. So let's have you go onto your back now. We're going to examine your knee and your hip. Okay, so let's look at her knee. So first thing I do is I straighten the knee out to see if it has full range of motion and extension, and then I do the same thing in flexion. So she has very good range of motion, and then I'll do some maneuvers to test the ligaments. I'm just doing a very brief exam here. But I can tell just from examining her and being able to pull her, bend her knee all the way up, that she does not have any perceptible arthritis, because a typical feature of someone who has bad arthritis is I can't straighten the knee fully, or it gets to about right here and stops, and there's a lot of pain if I try to push further. One does not necessarily need to go right to x-rays to get a picture of what's going on in the joint. By a good examination, a person can really determine if there's arthritis or not. Only in cases where it's very severe or the person might be thinking about going on to a hip replacement. So what I do to treat arthritis is prolotherapy. It's an injection procedure, very simple, but very profoundly effective. And I use natural solutions, not cortisone. Cortisone damages joints, and the use of prolotherapy natural solutions, when injected in the joints, can stimulate the body to repair itself. If the person had arthritis of this joint right here, I would just place a few shots around the joint, and likewise in these joints around the margins of it, and any place the joint bends is where the ligaments live. And so I would inject any of the knuckles of the hand that would start the process of healing. And when that happens, over time the ligaments get stronger, the slippage becomes less, and the wear and tear is corrected. And so doing, there's less pain and less disability, and you've then prevented that person from being on damaging anti-inflammatory drugs, use of cortisone, and ultimately joint replacement. So prolotherapy is a very effective treatment, and I'd like to encourage you to call our office at Lakeside Sports and Pain Clinic or visit us on our website at drmarkwheaton.com. So thanks for visiting today. Hope to see you next time.